July is Minority Mental Health Month, a time to bring awareness to the unique challenges that racial and ethnic minorities in our country face. Meredith, you're with someone from Hegira Health to give us some resources on that.
That's right, Chris. I'm here with Andrea Rodgers from Hegira Health. Thanks so much for being here.
Thank you.
Paying attention to this month, signifying the higher challenges that people from minority groups can face when it comes to mental health. Why is it important to raise awareness about this?
Because us as a community as a whole, we are in a collective and we want to be supportive of that. And minorities, because of systemic challenges and just access to care, have a higher percentage of being able to recover from mental health issues.
Are there specific conditions that we see that are more prevalent because of this lack of access?
So as a whole, a mental illness is kind of an equalizer across the board. What we see with minorities is that the symptoms can be more exacerbated because of that lack of access. So whereas someone would seek treatment earlier for depression, that access to care may not be available for minorities.
Okay, and tell us more about Hegira Health and the role you play within this field.
So sure. So we are one of the largest comprehensive behavioral health care providers, not just in southeastern Michigan, but Michigan as a whole. And culturally competent care is very important, whether it's trauma or minority-based. That is very important for those who are seeking out care.
And what sort of impacts have you seen within the community that you've treated?
So most recently, we've had town halls in regard to post-pandemic issues, opioid awareness, as well as mental health that is affecting the immediate members of our community.
So you just touched on the substance use as well. This isn't just, behavioral health or counseling for mental health. It's also substance abuse treatment.
A lot of times we see co-occurring issues as a coping mechanism, substance use as a coping mechanism for mental health issues in our community.
And how can people learn more about you?
Sure, you can reach us on our website, www.hegirahealth.org, or you can follow us on social media on all of our channels.
So you said you're across Michigan, not just Southeast Michigan. So do you have locations all across the board?
So we are able to serve Wayne County, Oakland County, as well as Macomb County. We have both in-person and telehealth services, so you don't actually have to come into our office. We want to make care accessible to everyone.
Right, and how does one go about getting care and initiating that?
So the first step is to make the call. A lot of people, that's their question. How do I know I need help? If you're asking that question, don't wait. Reach out to the professionals. We're here to assist. So you can call us directly. You can inbox us on social media, and we will return the call.
Well, Andrea, thank you so much for being here.
Thank you for having me.